Methods in Neuroscience, a review of subtle cognitive deficits in severe alcohol addicts. Do they show a specific profile? Alcohol dependency is an acute disease affecting many different individuals. Various community organizations provide services for therapeutic treatment, but to no avail. Patients unsuccessful in therapy often relapse, requiring hospitalization to treat symptoms and side effects. Research has indicated frequent alcohol consumption has a neuroprotective impact on cognitive function, and excessive drinking has been linked with structural brain damage and deterioration of cognitive performance. Brain damage associated with alcohol dependency presents in the frontal lobe, cerebellum, and the limbic system more than any other area of the brain. Limited research exists investigating the neuropsychological sequelae of multiple withdrawals in humans, and no prior research examines individuals with more than 5 relapses. The researchers hypothesize therapy resistant patients with more than 5 relapses would suffer from subtle cognitive deficits, mainly in the frontal executive functions. To complete this study, researchers recruited 22 inpatient and 20 healthy control subjects matched by age, education, and gender. Using the International Classification of Diseases, all patients were diagnosed with alcohol dependency and clinically examined by a neurologist. Patients were required to have at least a history of more than 5 years of frequent drinking with at least 5 withdrawals within the last 5 years. Testing was completed between days 7 and 21 of withdrawal, and participants using diazepam and clomethazole were not tested until day 7 after dosage. Participants with elevated ammonia levels and hypervitaminosis, hypothyroidism, electrolyte disturbance, or indicated inflammation were excluded. All nervous system disease, cognitive complaints, and the central nervous system affecting drugs were also prohibited, except for mild dysmorphia. One of the excluded were 3 patients unable to perform neuropsychological testing and 1 control subject for undiagnosed major depression. All participants completed the following neuropsychological tests: digit span subtest of the Wechsler's Adult Intelligence Scale, version 3, 2 classical versions of trail making test, Benton facial recognition test, syndrome Kirk test, facial expression emotional labeling, and a German version of the verbal learning memory test. The MWTB was used to assess crystalline intelligence, and the RWT was used to evaluate verbal and phonological fluency. The Beck's Depression Inventory, second version, was a self-completed questionnaire used to assess for signs and symptoms of depression. All participants performed a computerized short-term memory motor task. All participants were required to memorize a 4, 5, or 6 item finger sequence by moving a dot on the finger of a schematic of the left hand or right hand. Immediately after 5 to 7 pauses, a go cue was given for participants to reproduce the memorized sequence quickly and accurately as possible. Combining both types of delays and the 2 possible hands, each 12 distinct conditions were presented 6 times during the experiment, equaling a total of 72 random trials. To exclude motor dysfunction, a finger tapping test was performed. In this article, the independent variable is the cognitive performance on short-term memory tasks, measuring the sequence of length and timing and the neuropsychological test. The dependent variable is the group's patients, and control. The researchers measured data from neuropsychological testing using the MATLAB and the motor short-term memory task using repeated measure of analysis of variance. The researchers also included data measuring psychodemographic using the MATLAB, gender differences using sample t-test, and gender distribution using a chi-square test. The results reflected researchers' hypothesis. Therapy-resistant alcohol-dependent patients without cognitive complaints displayed subtle cognitive deficits compared to other control groups. However, in comparison to the control group, patients with no significant differences were found in verbal tests and short-term memory tests. Patients on average reported 307 milliliters or 15 beers daily and 8.9 alcohol withdrawal hospitalizations. Patients significantly lower performance on the TMA, TMB, RWT, and Benton tests, and the MWT compared to the control group. Patients also reported significant depressive features on the Beck's Depression Inventory 2. Participants made fewer errors for shorter memory sequence measuring the length and fewer errors measuring timing. Researchers observed a correlation between recall abilities and the test WAIS-3 backwards, TMTB, and Benton tests, indicating future use combined to determine memory and visual spatial functions. Frontal executive deficits demonstrate frontal lobe damage through glutamate mediated excitosity from recurring relapse. Deficiencies in the frontal lobe causes the inability to plan and control impulsive behavior, showing a correlation with recurring relapse in patients. A significant strength of the study is the findings supported the results. Severe addicts have subtle cognitive deficits. Based on the results of the patients and the control group, this study is reliable with internal consistency. A significant weakness in the study is no specific parameter is used to determine what defines a healthy control subject. Also, the control group did not present a past or current medical or psychiatric history, which could significantly alter the results. Finally, this study lacks supporting research. Comparable research only reflects the use on animal testing. Further research is needed to support the reliability and validity of this study. Researchers will benefit from completing a longitudinal study and utilizing a larger sample of patients and the control groups worldwide. Since no significant difference was found in the short-term motor task, researchers need additional measurement tools to assess future studies. Also, on the Beck's Depression Inventory is only used to assess depressive symptoms. Additional scales would be useful.